Welcome back, everyone. Having a baby is so exciting, but can also be kind of stressful. But right now, during a pandemic, there's so much more unknown. So to talk about that is Kim Stuck. She's a certified nurse midwife and nurse practitioner from Lone Peak Hospital to talk about all of the realities of birth during COVID-19. Thanks so much for joining us. Let's first talk about what Lone Peak Hospital is doing to make sure that everyone is safe, the expectant mothers, their babies, during this kind of interesting time.
Yeah, so at Lone Peak Hospital, we really are doing everything we can to ensure that moms, their babies, and all our staff are being kept safe during their stay at our hospital. So our expectant mothers are kept in their own rooms, apart from any COVID patients. All of our staff are trained in infection control measures, and they do wear personal protective equipment at all times. We do have a visiting policy. That is, if a patient tests negative for COVID-19, they are allowed 2 healthy visitors during their stay. Those visitors must be over the age of 18, and they must be the same visitors during that patient's stay. If a patient has either active or suspected disease, they are allowed 1 healthy visitor during their stay.
So definitely a different experience than someone is used to if they've had a baby before all this. Let's talk about COVID-19 specifically. Does that cause problems with an expectant mother's pregnancy? You mentioned if the mother tests positive, does that cause problems for her?
In general, if the mom does well, then usually the babies do well. If a mom tests positive and she is in the hospital, and she has the baby, we do have a NICU on the same floor just in the same area as the mom, so that the moms can be kept close to the baby. But overall, we've seen that the moms and the babies do well. That being said, we do watch the moms and the babies very closely, and if the need to transfer arises, we have that ability as well.
And what can families do to protect themselves? We talk about the restrictions with visitors, which is kind of unfortunate, but definitely necessary to keep them safe. What else can families do to make sure that the process goes okay and everyone stays healthy?
Of course, yeah, that is what's on everybody's mind right now. Following CDC guidelines, washing hands frequently with soap and water for 20 seconds, wearing face masks while you're out, avoiding social gatherings, using alcohol-based hand sanitizer, washing surfaces with a disinfectant. Of course, pregnant women should always use gloves while using a disinfectant. Also avoid being around sick people if possible.
Now, if you are pregnant and you think you might have COVID-19, what should that person do?
Well, if you're pregnant and you feel like you have COVID-19, if you feel like you're in labor, please contact the hospital so that we can prep for your arrival, so we can keep you and the staff safe. If you don't feel like you're in labor, please contact your provider so that they can guide you in what to do. We can do some testing and get you care.
Now, this is a question that I know a lot of people are wondering. I have, at least myself. Can a baby catch COVID through feedings? If the mom does come positive, what is the interaction like between the mother and that child during their stay at the hospital?
So right now we're really encouraging mask wearing if the mom is positive, but there really is no evidence of transfer through breast milk, really, or placenta at this time.
Okay, such an interesting situation that we're all dealing with, and so good to know that Lone Peak has everything under control and everything will be safe. If someone wants to learn more about your hospital, where should they go for more information?
Yeah, so they can go to lonepeakhospital.com and for more information, and we do have a COVID-19 hub on our website right there, so that will give you more information.
Okay, definitely an interesting time. Appreciate all you do for our community, and thank you so much for joining us today.
You're welcome. Thank you.
Okay, coming up, a new